Aloha all. Welcome to the 6th annual Children's Policy Agenda here in Hawaii. My name is Liza Ryan Gill, and I am the board president of the Hawaii Children's Action Network Speaks Board, our C4 arm. And we are so excited that so many of you could join us this morning. We have a great agenda today. We're going to be going over the 14 priorities that we have set out for the 2021 Hawaii State Legislative Session. These were pulled together with the input of 45 community champion members. And I just wanted to set a little bit of the context for this moment that we're in and the importance of continuing to protect and fund critical infrastructure for our keiki. Our state is facing an unprecedented health and economic crisis, but our children should not be the one to bear the cost of this, especially when we put it disproportionately on their backs. Underfunding, cutting, and or otherwise harming this critical education and services infrastructure that make our keiki safe, healthy, and ready to learn will only harm the long-term vitality of our state. And so with that, I want to pass this over to the new Director of Research and Economic Policy, Nicole Wu, who will be introducing all of our wonderful speakers.
Thanks so much, Liza. Welcome to everyone today. If you have seen the link to the Children's Policy Agenda, if not, Ryan, can you put it in the chat? We'll be going along in the order of the bills in that document, except for the first speaker, Lori Field from Planned Parenthood, who has a conflict, so she needs to leave early. So we're starting with her bills, and then we'll go through it in the order that's in the document. So Lori, would you like to start with your bills from Planned Parenthood, Northwest of Hawaii? And I can't remember the full name. Sorry.
Thank you, Nicole. My name is Lori Field. I'm the Hawaii State Director for Planned Parenthood Votes Northwest in Hawaii. And we are thrilled to join Hawaii Children's Action Network and its members today to look at the upcoming legislative package. We are thrilled that members understand that family planning is essential to the long-term health and economic security of our communities. And with that, they're pledging their support for adequately funding the family planning program that it provides free or low-cost family planning care for uninsured individuals. We'll also be putting our support behind a bill to require insurers to cover the full range of sexual and reproductive health care with no cost sharing. We know that the last 4 years have gutted a lot of the social service programs that we count on for reproductive health care. And so we want to make sure that going forward, our state is in a position to again, help ensure the long-term health and economic security of our families and communities. Thank you.
Sorry. Next up, is Brandy here? Or has she?
She's coming. She just didn't have the password, so she's trying to log in right now.
I'm here. Aloha. Good morning.
There she is.
Welcome, Brandy. Our next speaker is Brandy Carvalho. She's a parent, and she is here to talk about a bill on paid sick days.
Yeah, aloha. Thank you for letting me speak. I'm Brandy Carvalho, a proud parent leader with PLTI. I wanted to share a recent experience at work. It was over the Thanksgiving weekend, and my manager called to inform me that I was exposed to a coworker who tested positive for COVID-19. And per the Department of Health, I needed to quarantine for 14 days. So of course, everything was a blur, panic set in instantly. You worry about your family. If you need to separate, you're not really clear on what is going to happen or what needs to happen. And being that it was Thanksgiving week, I did have plans to host my dad, who's a diabetic, over for Thanksgiving lunch. And, I automatically started feeling bad with who I might have come into contact with because of the whole contact tracing. So it was a pretty crazy time. I remember just crying, thinking of if I'm going to get paid, how am I going to get paid? You know, am I going to make it through the holidays? So thankfully, I was able to get paid through the Families First Coronavirus Response Act. But obviously that ended on December 31st. And I still fear possible reoccurrences, being that I work in the hospitality industry. You know, will my employer allow me to use my sick leave? What if I don't have 10 days worth of sick leave if I needed to go out and quarantine again? So there's much to consider when in a family pandemic. It makes it that much more challenging, I feel, when you're stressing over finances or just the unknown of any type of sick leave benefits. So we definitely need to have something in place soon, I feel, that will give hardworking families some type of peace of mind. Mahalo.
Thanks so much, Brandy, for sharing your story. Our next speaker is Kathleen Allgaier from Hawaii Children's Action Network Speaks. She'll be talking about our new Access to Learning Law.
Good morning. I'm Kathleen Allgaier, Director of Early Learning and Health Policy. As I'm sure many of you are aware, last year the state made a monumental goal for early learning and children. The state decided that we were going to put kids first, and we were going to make sure that by 2032, all of our underserved 3 and 4-year-olds were going to have access to a quality, affordable early learning program. That work does not stop with the passage of last year's legislation. There's still work that we have to do to make sure that our children and our families are supported. And so we're going to continue that this year. We're very excited that we still have the support of the legislature, even during the difficult time right now that our state is facing, that we're continuing to put our earliest learners first. And so we're excited to work with all of our early learning community and our wonderful state legislators to pass HB 1342. Thank you.
Thanks, Kathleen. I'm the next one to speak. I'm with Hawaii Children's Action Network Speaks, and we're a member of the Hawaii Tax Fairness Coalition. And we're supporting their efforts to make Hawaii's tax system more fair. And also, especially during this time of very deep budget cuts, we're concerned that many of the services that serve Hawaii's children and families will be cut and make the recession even worse. So there are about 11 progressive revenue options that are being put forth by the Hawaii Tax Fairness Coalition that will raise in the ballpark between $550 million and $780 million a year. So that's not going to solve the entire budget problem for our state, but it would make a big dent, and I think we have to consider all options. Some of these progressive revenue options include things like raising income taxes on those at the top, for example, the top 2% of income earners. Also getting rid of a loophole to make sure that investment income, like on stocks and bonds, is taxed at the same level as regular working people's income. Right now, people who get their income mostly from stocks and bonds are paying a much lower income tax rate than the rest of us. Also increasing the tax rate on very, very large inheritances. And also corporate taxes. Corporate taxes are placed only on the profits of corporations. So we're talking about those who are doing well during this pandemic. During the Trump administration, corporations got a massive tax break. And Hawaii's tax rate is not very high compared to other states. So there seems to be some room there where corporations could afford to pay a bit more. There's also a proposal to make sure that those corporations that are global are paying the taxes fairly in Hawaii based on how much of their business is happening in Hawaii. There's real estate investment trusts, which is basically mutual funds for real estate. They currently don't have to pay any income tax, so making them pay just like everybody else. And increasing taxes on very high-end properties, over $2 million. So when there's a sale, increasing the fee that they have to pay. We know that high-end real estate has done really well during this pandemic. So if they're fortunate enough to be making a profit off of that, they could pay a little more. A couple of the other ones will be talked about later as by the Hawaii Public Health Institute. And finally, during the last recession, the legislature suspended some of the GET exemptions. So making some of the entities who don't have to pay the GET, making them pay it for a couple of years. And they got a good amount of revenue from that. So we encourage the legislature to look at those options. So those are the progressive revenue options. The next speaker is another parent from our Parent Training Leadership Institute, Summer Lee Yadao. She's going to be talking about the need for paid family leave.
Aloha. So when my son was born 16 years ago, I felt the pressure to find a sitter as my leave time was winding down. My husband also took time off so he could help take care of me postpartum, which was really, really needed. After calling many sitters, I decided to stay home, and because my pay would barely pay for a sitter, so it made more sense for me to just stay home and take care of my child. After the birth, I also took family leave again to help take care of my then 2-year-old as I recovered postpartum. I had a 4-year-old born at home, and this time it was much different. So after my family leave was up, I had to coordinate pickups and drops with a 6-week-old while working, caring for my older 2 children, while taking care of the bills in the house. So in these days of high stress and uncertainty and the need for community support, having paid family leave is vital for parents to be able to remain mentally and emotionally stable to care for our homes, our families, and to be productive employees. I also work full-time. Luckily, I'm working remotely. But even though I am working remotely, having paid leave now as a single mother of 3, as the head of household, having the ability to take time off to balance work, children, my children's schoolwork, and everything else in the home, the paid family leave is absolutely vital. Thank you.
Hello, Summer, for sharing your story. Our next speaker is Leslie Banauk from the Hawaii Association of School Psychologists. She'll be talking about the credentialing of school psychologists.
Aloha, everybody. So Hawaii remains the only state in the nation without some kind of credentialing for school psychologists. So typically we're either credentialed under certification route with the Board of Education or Department of Education, or we're under licensing for like the equivalent of Department of Consumer and Customer Affairs. Hawaii has not had any credentialing for school psychologists in my time here, and we are kind of new to the state of Hawaii compared to other service providers. Why is this important? So this offers protection. So if something happens that is unethical right now with a school psychologist in the schools, there is no way for a parent or a teacher or a student to report those things. So that's a little detrimental when we are working with a very very vulnerable population of students. They deserve that level of protection. In the same way that somebody going to an outside psychologist could report to the Board of Psychology if something unethical happened. In addition, school psychologists are billable for Medicaid services at the federal level. So the Department of Education is actually leaving all those Medicaid dollars on the table for the evaluations we complete, for the counseling services that we provide. And during this time when we're facing budget cuts and possible furloughing and laying off of employees or cutting vacant positions, it's vital now more than ever that we can continue to keep and fill these critical positions that could be then funded by those Medicaid dollars. Thank you.
Thank you, Leslie. And our next speaker is a student, Logan Lau, to talk about the regulation of e-cigarettes.
Hi everyone, my name is Logan Lau. I am a current junior at Kamehameha Schools, Kapalama, and for the past 2 years now, I have been on the Coalition for a Tobacco-Free Hawaii's Youth Council. And today, on behalf of the Youth Council, I'd like to speak to you all about our policy priority for this year's legislative session. So since 2018, the Youth Council has been working to end the sale of flavored tobacco products to help reverse the rising trend of youth vaping in Hawaii. And this upcoming year, we plan to continue our efforts in combating the vaping epidemic. And in order to do so, we have decided to advocate for a comprehensive bill that addresses two sides of the issue. So first, a comprehensive bill would tax e-cigarettes and vaping devices and end the online sale of these products. So this will prevent minors from obtaining them illegally off the internet, and it would raise their prices, driving demand down. Currently, e-cigarettes are the only tobacco products without a tobacco tax, and moreover, age verification on tobacco retailer websites is insufficient at preventing underage purchases. And thus, by restricting online sales to licensed sellers, we will correct this loophole and allow the state to enforce current tobacco laws on minimum age and taxation. And then the second part of the ban, the same part of the comprehensive plan, is a ban on flavored tobacco products, mainly including menthol, which is responsible for the minty flavor used in many e-liquids. And it makes it easier for youth to start and harder for them to quit smoking. This is evidenced by the fact that in Hawaii, 78% of native Hawaiian and Pacific Islander smokers smoke cigarettes. And the consequences of this are that while nicotine and tobacco addiction is deadly for everyone, native Hawaiians die at higher rates of lung cancer than other groups. And really, the time to act is now. And with a comprehensive bill in both the House and the Senate, along with studies indicating youth who use e-cigarettes are 5 times more likely to be diagnosed with COVID-19, and non-users and those who use both e-cigarettes and conventional cigarettes who are dual users were 7 times more likely to be diagnosed, thus compounding our current public health crisis. And then, so if this bill is passed, we hope to see a significant decrease in the number of teens using e-cigarettes, which will hopefully spell the end of the youth vaping epidemic. For far too long, big tobacco has been used, they've used elusive marketing strategies which target younger generations like my own, and appealing flavors are driving up youth tobacco use in our state. With thousands of kid-friendly flavors on the market and little regulation, the industry really has no incentive to stop selling them. These flavors, they ultimately entice younger generations and get them hooked on nicotine. And that said, it's no wonder why 95% of smokers start before the age of 21. And then again, to make matters worse, big tobacco focuses their marketing efforts in low income areas that are economically vulnerable. This in and of itself is a social justice issue. And because of this, tobacco use and tobacco related illnesses have been affecting Hawaii's communities disproportionately. Strategic targeting and aggressive marketing by the tobacco industry, which for years has labeled Hawaii as the menthol state, is a major factor in Hawaii's youth e-cigarette use. And thus it's been increasing both high school and even middle school student rates. And then in 2019 alone, the percentage of frequent high school e-cigarette users doubled. And when compared to all ethnic populations, e-cigarette use is the highest among Native Hawaiian and Pacific Islander youth, as myself. And the targeted marketing by these tobacco empires is the cause of this. So in closing, I'd just like to share a personal story of a high school student that gets addicted to vaping via flavored tobacco products. This soon grows into a much larger nicotine addiction, which leads into the use of other drugs. Nicotine rewires the brain, making users more likely to use and become addicted to other drugs. And this is exactly what happened. The nicotine addiction soon turns into a harder drug addiction. And while the student graduates and goes on to USC, within a matter of months, they are expelled and sent back to their home because of drug use. The story doesn't end there. They now have a prison record and they live on the streets. And this someone was a very close family friend of mine, which is why I'm here today to ensure that this never happens to anyone else. Thank you.
Thanks so much, Logan. Our next speaker is May Okihiro. She's a pediatrician for Waianae Coast Comprehensive Health Center, talking about a fee on sugar-sweetened beverages.
Hi, everyone. So I'm here to talk about the proposed fee on sugary beverages. We've talked about this before, but I think this year is the right time to talk about it even more. So like others, I have a little story, and this is a true story. So just a couple weeks ago, I saw a child come in for a well child visit, a 15-year-old, and he hadn't been in for several years. He was in foster care, and he's now settled in a nice foster home. But he had come in for a visit in January of 2020, and in that time span, he had gained almost 55 pounds. So in less than 2 years, he had gained 55 pounds. And when I asked him about, how his lifestyle had changed, he had said that for one thing is he had no schedule, so he was staying up late, that sort of thing. But he was also consuming between 4 to 6 or so sugary beverages a day. Um, and so if those of you who have struggled with weight, and I think many of us have tried to eat better and exercise more, that sort of thing, you know that when you drink sugary beverages, you can still eat a full plate of food. And so sugary beverages are an easy way to get added sugar and are the number one source of added sugar in our diets. So the bill is to add 2 cents per ounce to sugary beverages. And it's estimated that it would bring in about $65 million in the first year. And that what we hope, sorry, the garbage truck is going by. We hope is that we will use this to create a special fund that would then go on to fund health and wellness programs across the state. So the exact program hasn't been determined yet, and I think we want to keep that open and get community input for that. But it could be adding funds to the Double Bucks program so people can buy more fruits and vegetables. There's produce prescription programs for families so they can buy more produce. Other health and wellness programs like parks and recreation, school cooking classes, and also oral health services, which are very underfunded in our state. So we're hoping that people will support this bill. It's HB 330 and SB 541. So if you have any questions, please let me know. Thanks.
Mahalo, May. And our final speaker on the bills this morning is Paula Adams of the Hawaii After School Alliance. She'll be talking about 2 bills.
Thanks everybody for having me over. So I would like to talk about after school, summer learning and community schools. We know that the learning loss is real and that our kids and youth are also need social and emotional support. So for this reason, these 3 legislation pieces are supporting our kids and families. The first one is to urge the Department of Education and the Board of Education to support and implement after school programs to combat learning loss. We know that Hawaii is the only state in the country that has a statewide after school program, which is the A+, but we need to keep supporting those programs as well. Also, we know that REACH, the after school programs, is the only after school program supported and funded by the state. So we need to keep that funding in the budgets as well. The second one is to support the implementation of community schools and as a strategy to increase access to high quality education. As you may know, the community school strategy is when the school becomes the hub of the community, when the whole child is being taken care, and they are providing services to the children like health services, mental health services. As well, there is a strong family and community engagement component. So we believe that this strategy will support our kids when they return to the facilities, when they return to the schools as well during the pandemic. The third piece is about summer learning programs. Summer learning programs are going to be essential and they're going to be key for our kids to catch up, for our kids to reconnect, for our kids to figure it out how to come back from so many months of isolation. We are asking the Department of Education to coordinate these summer learning programs within the department, but as well with community organizations. We believe that the department, instead of using the first come, first served system, should be strategically oriented about how to enroll kids, how to enroll the students in the summer program, so the most vulnerable population have access to those programs. So those are the 3 pieces that we are supporting. So if you have any question, please let me know. Thank you.
I'm Deborah Zeisman with Hawaii Children's Action Network Speaks, and I have the privilege of just saying thank you to everyone. Putting this package together was a huge amount of work from many on this call, and our objective each year is bringing a variety of community voices to the table and putting together a well-researched and data-driven policy agenda that really will meet the needs of all of our children around the state. I am incredibly proud of these 14 priorities that we're presenting and pushing this year. I do think they are solid and sound and truly things that many in the community can get behind to make sure that, as we said at the beginning, all of our children are healthy, that they are safe, and that they are ready for school and thriving in school. That is our objective each year. And that this agenda is really stood behind by many of our community experts, from our nonprofits, from the universities, and also from people with real experience in the community, from our parents and from our students, who all come together and try to collaborate and push collectively for what's in the best interest of our keiki and our families. So I appreciate it. We will be updating everyone as session goes on about the progress of these bills. And if you are interested in advocating for these bills, please let our team at HCAN Speaks know. We can help loop you in on what's happening, how to testify, things that the legislature are a bit different this year. So we are helping just some support and some training on how you can have a voice if you're a nonprofit, if you're a community member. We are here to help because, again, at the end of the day, we are hoping to all work collectively together to make Hawaii the best place to be a child and to raise a family. So thank you all so much for coming, and we look forward to working with you in the coming months to make these bills actual into laws and reality. So thank you so much. Have a great rest of your day.